Welcome back to another episode of Med Madness. Today we're diving into an important topic in obstetrics, cervical insufficiency. This condition, though often silent, can have significant consequences if not properly managed. We'll explore what cervical insufficiency is, discuss the key risk factors, and outline the clinical features that can help with early diagnosis. By the end of this episode, you'll understand how to manage this condition and prevent pregnancy loss. We'll also wrap up with a real-life case study to bring everything together. Next, let's discuss what cervical insufficiency is. Cervical insufficiency refers to a structural weakness of the cervix that can lead to painless cervical dilation, often resulting in second trimester pregnancy loss. Unlike other causes of preterm labour, cervical insufficiency tends to present without the typical symptoms of pain or contractions, making it a subtle yet serious condition. Now let's look at the risk factors for cervical insufficiency. There are both inherent and acquired causes that can predispose a woman to cervical insufficiency. First, let's talk about the inherent causes. These include inherited collagen disorders such as Ehlers-Danlos syndrome, which can weaken the cervix, and uterine abnormalities like a septate or bicornuate uterus, which can compromise its integrity. Next, let's move on to the acquired causes. Acquired causes of cervical insufficiency include cervical conization, a procedure where a cone-shaped section of the cervix is removed to treat or evaluate an abnormal pap smear. This procedure can shorten the cervix and reduce its structural integrity. Additionally, previous cervical lacerations during childbirth can diminish the cervix's tensile strength, leading to insufficiency. Now, let's discuss the clinical features of cervical insufficiency. Diagnosing cervical insufficiency can be challenging due to its subtle presentation. A woman with this condition may have a history of 2 or more painless second trimester losses. Symptoms, while often mild, may include increased vaginal discharge and pelvic pressure. Upon examination, a clinician may find painless cervical dilation, sometimes accompanied by prolapsed or bulging membranes. Next, we'll look at how cervical insufficiency is managed. The primary treatment for cervical insufficiency is the placement of a cerclage, a surgical procedure where a suture is placed around the cervix to reinforce it and prevent further dilation. This intervention is crucial in preventing pregnancy loss in patients diagnosed with this condition. However, caution is needed when placing a cerclage in patients with bulging membranes, as the procedure carries a higher risk of complications such as membrane rupture and intraamniotic infection. Next, let's consider a real-life case study. Let's consider the case of a 34-year-old woman in her 21st week of pregnancy. She presents with complaints of increased vaginal discharge and mild pelvic pressure, but no pain. Upon examination, her obstetrician discovers that her cervix is dilated, with bulging membranes visible. This patient has a history of a cervical conization procedure following an abnormal pap test a few years ago. Based on her history and current presentation, she is diagnosed with cervical insufficiency. After careful consideration, a rescue cerclage is placed and she is closely monitored for any signs of complications. Thanks to timely intervention, she is able to carry her pregnancy to term, delivering a healthy baby. Now let's wrap up with a summary of what we've covered. To sum up, cervical insufficiency is a condition characterized by painless cervical dilation, often leading to second trimester pregnancy loss. Understanding the risk factors, such as inherited collagen disorders and previous cervical procedures, is key to early diagnosis and management. The primary treatment involves placing a cerclage to reinforce the cervix, though this procedure must be approached with caution, especially in cases with bulging membranes. Thank you for tuning in to today's episode of Med Madness. Don't forget to check out our pre- and post-podcast quizzes to test your understanding of cervical insufficiency. We've also created Anki flashcards to help reinforce the key concepts covered today. Stay engaged, keep learning, and join us next time for another deep dive into the world of medicine.